So our first startup of the row is called Star Robotics, and they design and commercialize autonomous mobile robots for assistance, surveillance, and inspection. And you're going to meet one of their buddies who's going to join them on stage. So Sergio, whenever you're ready, stage is yours. Big applause to Sergio from Star Robotics.
Hi all, my name is Sergio, I'm the CTO of Star Robotics. I guess that almost none of you have ever seen a real robot doing real things in real life, and less likely your perception of what an autonomous robot is fall close to our solutions. We have detected several tasks that can be easily performed by humans, are very repetitive, and the current state-of-the-art technology could outperform human workers in terms of efficiency and cost. I'm talking about surveillance tasks, industrial inspection, and what most concern us today, assistance to people with disabilities. For that purposes, we have developed our current solution, our platform that you can see. It's called WatchBot. That is a modular robotics solution that could be configured as an assistant or as a watchman. Briefly describing our technological innovations, our light platform allows us to operate until 16 hours a day, both indoors and outdoors. One of our greatest competitive advantages resides in our in-house developed localization algorithms that allows us to move our robot inside really crowded environments like train stations or malls. We also offer complete cloud software where you can manage the whole fleet. You can supervise the robots or even teleoperate it in real time if you need it, if required. And we also offer an accessible interface that allows the user to interact with the robot regardless of their disabilities. I would like to share with you a quick video of a robot moving in a real environment. This is in Chamartín, here in Madrid, where it is guiding a blind guy, also with the guide dog, where you can see that it can also carry a suitcase, and this is how it navigates inside the facility. And these robots are a really disruptive technology because in a huge traditional market, it offers a savings of up to 80% of the cost. Taking into account that almost 1 million people suffer from some kind of visual impairment in Spain, this solution will lead to a big social impact, as this device provides autonomy to the user to move in complex environment where otherwise human intervention will be required. And I would like to say, just to finish, that we have a 2 million round open now, and if you want to know anything more, come to the 93 stand.
Good applause, big applause for Sergio. Give it to them. Yeah, you can say here with me. Have you seen his mustache? That's amazing. I need to grow something like that, right? It's pretty cool. Questions? Marta, go ahead.
I was wondering who is the team that is supporting this startup?
I think I have it here. We have our CEO that is also here, that has a lot of experience in building robotics. Me, that I'm the CTO. Some other guys with a lot of experience in electronics, mechanical, and cloud engineering, because we manufacture all the whole product from the hardware to the software, the AI, and everything is done in-house.
Okay. We have time for a super quick second question. Rebound. Rebound? Like.
Thank you, Angel. Which is your business model?
Is B2C and B2B. We are able to sell the product and also offer services.
But you sell it to the end users? Or you sell it, for instance, to the airport?
We can sell it to the end user. No, not the end users. In this case, with the assistant, we sell it to the infrastructure manager or the AENA here in Spain for the airports or so on.
Okay, perfect. Well, big applause to Sergio and Alice. Okay, and our next picture. Let's see if Alice manages to skirt around. There you go. I love when we bring props on stage. That's pretty cool. Okay, here we go. So our second picture of the morning is also, she was pitching also like Sergio on the other stage. We're going to be talking about how can we scale the tracking and monitoring of those diseases or therapies that require to be, that are chronic, that you have to be calling all the time, you have to be dealing with all the time. And sadly, with the lack of medicine professionals that we have, and it's not getting any better, however, chronic diseases and similar things are growing exponentially. So how are we going to deal that? Well, to talk precisely about a technology that's going to help us scale that, I want to welcome our next pitcher, Maria Gonzalez, CEO and co-founder of Tucubi.
Thank you. Okay. Should I put the presentation or? Should I put the presentation or is it? No. Okay, great. Thank you. So hello everyone. I am Maria. I'm the CEO and co-founder of Tucubi, and we develop empathic AI to automate medical monitoring for phone conversations. Because we are living in a moment where the demand for care is only increasing due to aging, due to chronic conditions, while on the other hand, there is a huge global shortage of healthcare professionals. So this imbalance is making our healthcare systems more and more unsustainable. So we founded Tucubi to tackle this and to help doctors and nurses scale their ability and focus their time when they are most needed. We developed the first CE mark voice-based medical assistants that monitor health status of patients by speaking with them via phone calls. And her name is Lola. This means that if a doctor has 1,000 patients assigned, and that's a reality today, she knows she can only attend 15 patients physically per day. So with Tucubi, she knows who are the 15 patients that she should attend today. How? She just needs to choose from our platform what type of monitoring she wants to active for her patients. So for example, if it is a post-surgery monitoring or follow-up, she can choose an evidence-based protocol about bleeding symptoms or infection symptoms. And automatically, Lola is going to call all her patients to speak about this protocol through a phone call. So no internet, no smartphones, no apps, just a normal phone call. And in this way, we reach all the population. So they maintain a natural conversation, and natural language processing algorithms analyze, structure, and prioritize these conversations. So now the doctor knows who are these 15 patients that need attention, because 10 a.m. in the morning, Lola has already spoken with the whole 1,000 patients and sent information back to her. So we work with healthcare systems to help them augment the care capacity and to improve outcomes, and also with pharma companies to understand how patients behave in the real world and to provide beyond the pill services. And all of this with a great patient satisfaction, because they do not feel they are speaking with a machine. What they feel is that there is someone keeping an eye on them while they are at home. Our business model is a SaaS B2B model in which clients pay an annual subscription based on the size and on the patients that they have. And so far in 2022, we've already doubled last year's revenues. Sorry. Lola is already speaking with hundreds of patients every day in Spanish, in English, and in Portuguese, with outstanding 95% engagement of patients. And there are more voice systems in the healthcare market, but focus on administrative tasks, not on medical tasks. And we are the only platform with CE clearance to provide monitoring, voice monitoring for patients in Europe. Thank you.
Big applause for Maria. Thank you very much. Okay, judges, questions? Any questions?
Thank you, Maria. Tell us something about the team, please.
Yeah, thank you. Nowadays we are a 12-people team and also work with medical advisors, external medical advisors. Our team is composed of biomedical engineers. I think most than half of the team, also myself, are biomedical engineers. We also have nurses, doctors, and people from conversational design, focused on making the patient experience with the virtual assistant as best as possible.
Thank you. Congratulations. And what are your forecast for income?
This year?
This year, around?
Around 300K.
Okay.
You see, Price always looking at the finances.
Always
It's an important point.
We have time for one more question if anyone wants to throw one more.
I want you to explain a little bit about how important it's having a robot, and that the effect that a robot has calling you when you're old is sometimes better than your daughter calling you.
I will say no. It's not better than a daughter calling you. It's not better if I could choose a nurse calling me every day, I will obviously choose a nurse. But the situation now is that there is no nurses. So people is having like every 6 months, every 3 months consultations, or they have to go to the emergency room. So what we want to do is like every patient to have at least a weekly conversation about medical issues and just go to the doctor when they need it, but they feel that they are being accompanied through the journey.
Okay, perfect, Maria. Thank you very much. Big applause for Maria. Thank you, judges. And we're moving, when we think about chronic diseases, like everyone kind of pictures this, right? But when we start talking about rare degenerative diseases, especially when it comes to children, there's not that much stuff going on. And so I'm very, very proud to introduce our next startup because they've been doing an extraordinary work. We've had them here many years ago. Their CEO and one of the co-founders was featured nationally, national TV. They received many prizes, and it's an incredible project. So please welcome our next startup, Marcy Bionics, and his co-founder and commercial director, Ignacio Barraque.
Thank you. Hi, thank you. First of all, let me to thank Fundación 11 and NetMentora for help us from the very beginning and to be with us, especially in the tough moments. So let me introduce to you Elena García Armada. She is our CEO and also is the leader manager of our research project here in Spain. So he has the opportunity to test one of her robots in a girl that had spinal cord injury after a car crash accident. So the emotional impact she suffered was huge. So she decided to change her research from industry to healthcare and to create the first pediatric exoskeleton of the world. So we analyzed the market and we saw that in Spain we have more or less 200,000 children that can't walk every day. So the rehabilitation they are doing every day can solve the problems they have. So they are forced to use major chirurgical procedures to maintain their quality of life. And robotics can help them to maintain these qualities of life. So also we analyze also competitors, and all of them, they are focused on adults. So that's why we decided to create a company and to make and to build the first and unique pediatric exoskeleton in the world. And we did it. We got it. Yes, this is the exoskeleton, and it's working, and we are ready to market it. So better than me, let me families to show you how are the benefits. Sorry, there are subtitles, but I think we haven't these subtitles, but the explanation is they are increasing the capacity to make force not only in the lower limbs, but also in the upper limbs. They are changing also their mental capacities. They are able to collaborate with other children, and also it's not only a physical improvement, it's a global improvement for children, and it's an urgent need that they have every day. So it's not only a physical or emotional improvement for patients, it's also that we can save millions of euros every year for public health system. We are making sales all over the world. We are ready to be marketed, and we are the most recognized and awarded company here in Spain, especially here in Madrid. So we are very proud to be here, and we really thank you the support we are giving us and the opportunity to be here to present our company. And yeah, we are ready to go to the world and create more products and help all those children all over the world. So thank you.
Well, let me tell you a backstory. He was pitching yesterday, and I had to push him off stage, and he's like, I'm going to make it on time. He still had 5 seconds.
Yeah, that's...
Okay, judges, questions, please.
Can we know a little bit about the team?
Yeah, we are 24 people here in Marcy Bionics. It's a very powerful team. We have all the areas, financials, communication. Víctor Chacón is our leader in this area. Also, we are a public research team, so we are a team inside CSIC working in our company. So we are an R&D company, and the company is made only to, as a channel to make this innovation through society. And yeah, we have a clinical team also and a commercial team with 4 people also in our commercial. So thank you.
Thanks, Ignacio. I have 2 questions. One is about the scalability of the product you are evolving, whether it needs to be fitted to the kit or you can somehow adjust it, but you are just building one product. And the second is, which are the limitations, or how long can the kit have it, you know, for which tasks, which is the intended use in a way of your product?
Yeah. Thank you. So the last one is all children between 3 and 11 years old can use the device. It's a preventive device. So the sooner they use the device, the better it is for them. So it's a preventive tool. No, it's not only a limitation about how they grow, but it's to use as soon as possible. And the other question was, sorry?
On how long can they use it at once?
They can use it every day. And the other question, sorry, they can use it every day.
No more questions, Nacho. Sorry.
Yeah, it's an hospital. It's a device for hospitals, but we are developing a product line specifically for homes and for help these children in any place.
Big applause to Ignacio. Thank you very much. Thank you, judges. And now we're moving to another really fascinating, at least for me as a person that does a lot of trainings, fascinating aspect is sometimes we don't realize that not everyone is like us and not everyone has access to all the information that we have. And precisely to fix that, to enhance the capacity for people that are impaired in different senses, we have our next startup. But maybe the most important thing about what they do is that they allow you to personalize that. We don't learn, all of us don't learn the same way. Each of us learns in a different way. And precisely to provide that flexibility, we have our next startup. So please welcome Ignacio Estellés, CEO, Antonio Kaiser, CEO of Be My Vega, or Vega.
Thank you.
Big applause.
Hi, everyone. 8 years ago, I had a daughter with albinism and low vision. At that time, I didn't know what she would be able to see in the future. But today, I know what she sees. This is what she sees. And she's not alone. More than 200 million of people have to face, according to World Health Organization, to the same problem. But more important than what they see is what they don't see. According to experts, more than 90% in a communication like this is nonverbal. She's Mary. She's from Australia. She has to use a spyglass to be able to get a part of a communication. And it is not a problem only for people with low vision, it's a problem for everyone. How many times we are in a class at the back and you can see the writings on the blackboard? How many times you are in a conference and you can see the speaker or the slides? So we have the solution to this problem. We get all the experience and we put it on the hand of everyone that wants to receive this experience. It doesn't matter if you are face-to-face in the room or you are at home receiving the experience by remote mode. We have three differences with respect to our competitors. First, we capture whole experiences. Second, we give the control to the users. Each one of us learn in a different way, so each one of us need to see a different thing to improve our learning. And the third and very important point, we add a lot of tools to permit everyone to access to the knowledge with the same opportunities for people with low vision, for people with low hearing. This solution didn't exist, so we created it. And today, our business model is based mainly in software. We have a SaaS model to get money. And many universities, many educational centers, many associations trust Be My Vega. They are today our clients, and it's the time. More than 700,000 training rooms only in Spain, an online training market that is growing day by day. We have a good team with many engineers, some of us with a PhD, with high experience in education and also in research and development. And we have traction. And we have received more than 700,000 euros of financing. And also we have partners, very important partners. One of them, Telefónica, is selling right now our solution. And this is the origin of this project. This is Vega. This is my daughter. She doesn't need to stand up in front of a board each time the teacher writes something on it because she has Be My Vega. And also, she's able to look at the face of the teacher in order to see if she is happy or not. Universal access for everyone is not only a necessity, it's not only a right, it should be a hallmark of our society. We are changing the way people access to the training in order to permit everyone to have the same opportunities. This is our purpose, and I invite you to be part of this change. Thank you.
Boom. Very good. Great job.
Thank you.
Okay. Do we have questions for Ignacio? No, Antonio. For Antonio, please.
How affordable is the device? Is it very expensive or?
Yeah. When we detected the pain, we developed a solution that was based on hardware and software. So many universities, many education centers buy this product, and they pay more or less around 5,000 euros around for the hardware and the software. But we realized about one thing. We could adapt our software in order to be able to be used with other cameras of the room. There are many cameras in many places, so we adapted this software to do this. So we can provide our hardware because we have a gross margin higher than 50%, but also we can install our software and get the fee of a subscription. So this is more or less today our business model.
We are Spaniards. It's adjustable. It's always adjustable. Always flexible.
Congratulations, Antonio. Do you have first results? Resultados del producto.
Resultados, yes. So, by the moment, most of the sales that we have done has been reactive. So the customers come to us and ask about the product, and we sell the product. So now this is the reason why we are in a round, because we want to get stronger our commercial structure in order to be able to sell our product, our solution. Now we have many important sales channels, for example, Telefónica, Crambo, Pentec, that have included this solution in their portfolio. And we need a structure of commercials in order to permit supporting this solution. So right now we have around 200,000 euros of sales, and we hope to get more or less 1 million euros at the end of this year.
Perfect. Antonio, big applause for Antonio. Thank you very much. Thank you, judges.
You're welcome.
And now, yes and yes. We have our next startup talking about a mobility solution that's comfortable, sustainable, economical in assisting people with disabilities and freight transportation. And to literally show us and not tell us, we have Ignacio Estellés, CEO of Moevo.
Finally, what a pleasure. Okay, here we go. Sorry in Spanish. Somos Moevo y lo que es una compañía que lo que quiere es mejorar la movilidad de las personas, y lo hacemos a través de soluciones eléctricas, limpias y sostenibles, ¿vale? Y, perdón, aquí. Todo empezó intentando ayudar al hijo de un amigo, José Lete, que tenía parálisis cerebral de por vida, claro. y los padres estaban impedidos y no le podían sacar a pasear. Y nadie en la familia quería, y nosotros con un juguete y algo de ingeniería, pues construimos un prototipo, y realmente el prototipo cambió la vida de la familia, porque de pronto todos se peleaban por sacar al niño, los abuelos, los hermanos, y podían pasear por todo Madrid, por el Retiro, incluso ir de vacaciones y dar paseos que antes no se lo podían permitir. Nos pidieron muchos más prototipos del entorno, y entonces decidimos patentarlo y sacarlo y ofrecer estos beneficios a mucha más gente en el mundo. Y justo cuando lo estábamos lanzando, 2020, pues tuvimos que parar por la pandemia. Pero teníamos un stock y se lo ofrecimos al hospital de IFEMA. Con esas largas distancias y pesos conseguimos ayudar al personal sanitario, que realmente pues, se hacía muchos kilómetros, y conseguimos ayudar no solo a transportar pacientes, sino también a aplicar otro tipo de aplicaciones de esta tecnología a carros de medicamentos, de medicinas, analíticas y luego documentos. Y entonces luego hemos tenido un desarrollo de esta misma tecnología a otros sectores de última milla, de correos y demás, ¿vale? Pero centrándonos en el sector salud y asistencial, que es nuestra genética, todo el mundo piensa normalmente en la persona que va en la silla de ruedas, pero pocos en el que empuja, el cuidador, porque también tiene un grave problema, primero de esfuerzo, luego de limitación, porque limita mucho su ámbito de movilidad, y luego también porque tienen lesiones muy graves. Hasta el 73% de las personas tienen lesiones por empujar permanentemente una silla de ruedas, ¿vale? Moevo es la única solución que transporta y te transporta, ¿vale? Y es con este sistema tan fácil que además tiene las siguientes ventajas. Transporta naturalmente a las personas sin ningún esfuerzo, mejora la salud del cuidador, pero también hace un antes y un después en la experiencia de movilidad de la persona transportada, porque le amplía su ámbito social, laboral, escolar, ¿vale? Es una propulsión eléctrica limpia, se puede acoplar a cualquier silla de ruedas del mercado mediante este sistema de barras que es universal, ¿vale? Tiene autonomía para en torno a 20 kilómetros o unas 4 horas que da para pasear por... ¿Ya? No puede ser. Espera, déjame enseñar cómo funciona. Bueno.
Tú dejas el vídeo puesto y ellos te hacen las preguntas.
Vale.
Aplauso para Ignacio, por favor.
Gracias. Gracias.
This is hard. It's not easy. It's not easy. Okay, judges.
You can ask in English, no problem.
Yes, I'm going to force you to answer in English. Don't worry.
Okay.
Marta.
In Spanglish.
Ignacio, how about your business model? Like, how have you been saving? Is it B2B? Is it to the end user? What? And it's the pricing competitive? I guess that there's no other device in the market, or is it?
Yes, good question. Here you go. It's a business model based in the product. We have a product which is unique in the world, and we have a problem which is a global problem everywhere. So our product, our engineering, offered through distributors and through orthopedics, and through the web, the e-commerce, offer our product to the end consumer and the families. This is on one hand. On the other hand, we have the B2B. We're selling this to Hospital Puerta de Hierro and many others which are interested to try. It's not easy because it's always difficult, the hospital or the residence environment, more nowadays, which is almost impossible, but we have the strong commitment with that. They're both.
Thank you.
Okay, super brief question, extra question? No? Okay, well, Ignacio, thank you very much. Big applause for Ignacio.
Thank you. Sorry.
As if you, which space? Oh, it goes backwards also. Nice. That's a striking figure. I'll tell you that. Okay, so last but not least, our last startup of the block, and because it's true that when we talk about these things and helping others, we always focus on. We were talking about chronic disease, we were talking about people with disabilities, but the truth is that in a lot of these cases, we always require, to a certain degree, caretakers. However, we always focus technology on the disabilities themselves and not in providing powerful tools for the caretakers also. And precisely to change that, we have our last pitch of the block, and I want to welcome on stage the CEO of i4Life, Marian Garcia Prieto, to talk about that. Big applause.
Oh. Sorry. ¿Cómo puedo dar para atrás? No va. Sí, sí, pero no va. Ahora, okay. The thing is that in the world, more than 15 people are invisible. They removed my first slide that was nobody there. These are for people that share a problem. They are suffering from Parkinson's disease. They had to face every day with episodes that are called freezing of gait. They go out, they walk normally, and suddenly their brain stops to know how to walk. They get freeze there on the floor, and they can't walk. They need an external stimulus in order to recover the gait. We've been working with them and also with the caregivers and also neurologists, and we designed that solution that is Pauto. It's a smart walking stick that gives a cue, a visual cue, a laser that helps people to recover from gait. That solution is powered with artificial intelligence. It's geolocated and reports alerts and faults to the caregivers. Our numbers are great. We have an increase in the activity, we have less number of faults, and each time more and more users, not only suffering from Parkinson's, but from other pathologies or even healthy people, are using Pauto. We have that model under B2C and B2B and B2B-C. And when compared with other solutions in the market, we offer more functionalities, more connectivity at a similar cost. In i4Life, we develop easy-to-use technology powered with AI in order to connect dependents to their caregivers and improve their lives. This is, for sure, an awesome project, thanks to our team, our advisors, and our partners. We have that commitment, that purpose of thanking the elderly, what they have done for us, by technology, by means of technology. We are absolutely going to make people not only turning them from invisible to visible, but what we want is them to bright. Thanks a lot.
Good. You see, she's like, I'm going to do it in 2 minutes. It's going to be fine.
Three and the problem at the...
It's a clicker.
Yeah.
She went with power. Judges, questions, please.
I think I saw the business model is like an upfront price and then a subscription price, or is just one shot?
At the moment, we have a business model that it consists on buying the device and a monthly fee. But we are now exploring a new possibility of having a renting that probably will be more interesting for the people, because we remove a barrier that is the initial cost.
Thank you.
Thank you.
Another question? Anyone? No? Yes? Susie?
Thank you. Can you explain us a little bit more which is the input that the device gives to the users?
Yeah, sure. Initially, the input was only that visual cues, so that people can restart the gait when they suffer from freezing, okay? But as we started to develop the solution with them, they asked for geolocation, they ask for reports to the caregivers, and then what we have now is a device that helps the patient with the lights and helps the caregiver with information about the patient. For instance, you know if your father, for instance, uses the Pauto, you know if he is now awake, he had a good or bad night, or much more information, and we are mixing it so that you receive only one important information, and you can be, you have more peace of mind in that.
Okay.
Caregiving. Okay.
Perfect. Well, big applause for Marianne. Thank you very much for joining us. I want to welcome on stage someone that's very, very beloved in this house that we've had the pleasure of having for many years now. So please welcome with a big applause Jesús Hernández, who is the Director of Universal Accessibility and Innovation at Fundación 11. Big applause for Jesús. We have Team 11 here. El equipo 11.
¿Qué tal, Alex?
¿Qué tal, Jesús? Un
Muy
placer.
bien.
Placer tenerte como siempre.
Pues sí, la verdad es que es un lujo estar por aquí.
A ver, cuéntame un poco de qué va esta iniciativa. ¿Por qué montáis esta iniciativa?
La iniciativa de los premios, porque nos gustaría hacer de forma transversal, que realmente se reconocieran todos los premios, o sea, dentro de los premios, el impacto social. Proyectos de emprendimiento que ponen en su base de trabajo a la persona. Por eso ha sido esta iniciativa, el poner en marcha. Llevamos colaborando con Sausavi varios años, como bien sabes, pero el hecho de lanzar este año los premios para nosotros era importante. Ya consolidamos nuestra presencia en el Sausavi.
Eso te iba a decir, digo, se os ha ido metiendo el gusanillo poco a poco y al final he dicho, ya, nos liamos la manta a la cabeza.
Sí, nos hemos venido arriba.
Porque además me gustaría, sobre todo para compartirlo, tú y yo lo estábamos comentando antes, pero creo que es importante que esto quede grabado y que la gente lo escuche, ¿no? ¿Cómo habéis vivido la pandemia vosotros desde la Fundación?
Pues mira, toda la sociedad la ha vivido de una forma muy dura, pero nosotros especialmente, ¿no? Porque de repente nos tuvimos que ir todos a trabajar a casa y no teníamos la tecnología preparada para trabajar desde casa desde el punto de vista de la accesibilidad, ¿no? Aquellos que tenemos problemas de movilidad física nos vino bien, porque teníamos que desplazarnos todos los días, pero aquellos que tenían algún tipo de discapacidad sensorial les vino muy mal. Como compañeros sordos o con deficiencia auditiva no podían comunicarse bien a través de las plataformas, como los compañeros ciegos o con deficiencia visual, las plataformas no estaban pensadas ni diseñadas para que personas con algún tipo de discapacidad o de este tipo de discapacidad pudieran interactuar con las plataformas en igual de condiciones que el resto, ¿no? Con lo cual hubo verdadera exclusión en ese ámbito, más allá de los miedos que teníamos todos, ¿no? Y más allá de tener a nuestros vendedores del cupón, que es nuestra fuente de ingresos, encerrados en casa sin ningún ingreso durante más de un mes. Aquello fue realmente duro, lo sufrimos muchísimo.
Sí, no, y supongo también, además, al final sois una gran familia, ¿no? O sea, el no poder ver a los compañeros y no poder estar en contacto físico y próximos a ellos también tuvo que ser muy
Fue
duro.
durísimo. Además, tenemos un proyecto de impresión 3D y tuvimos que poner todas nuestras impresoras y desplegar todas nuestras redes para imprimir mascarillas, para imprimir máscaras, para imprimir diferentes elementos que hemos desarrollado en impresión 3D, ¿no? Con lo cual fueron momentos duros. Ayudar a imprimir respiradores también, o sea,
Esa fue dura.
Sí, los momentos duros por aquel entonces, sí. Prefiero no recordarlo.
Crucemos los dedos. Pero sí, estaba yo pensando, digo, voy a ser malo, ¿no? Pero ¿habéis sacado algún tipo de plan de ataque o plan de choque, ¿no? Porque claro, a vosotros os pilló. Yo hablé con distintas organizaciones, ¿no? Y me decían, bueno, nosotros, por ejemplo, recuerdo hablar con Repsol y me decían, no, es que nosotros tenemos como un plan de emergencia en donde todo el mundo tiene dispositivos, todo el mundo sabía más o menos qué hacer en caso de que no tuvieras que ir a la oficina. Claro, vosotros os lo comisteis de lleno y no solo eso, sino que probablemente muchas de las interacciones que tenéis no son viables con la tecnología que hay ahora. Entonces, ¿habéis estado dándole vueltas a un plan? ¿No? Pues
bueno, ahí, Alex, comentarte, además tenemos el equipo de I+D por aquí. Ya pensamos y que éramos conocedores de esa problemática antes de que hubiera una pandemia. La pandemia la ha venido a acelerar, ¿no? Pero ya estábamos desarrollando un proyecto de investigación, de desarrollo, para desarrollar tecnología completamente accesible y poder permitir lo que hasta ahora la tecnología nos está permitiendo. Con lo cual doy la enhorabuena al equipo, a Almudena, a Jessica, a todo el equipo que han estado ahí al pie del cañón en este proyecto, ¿no?
O sea que habéis sido, eso te iba a decir, ¿eh? Aplauso para el equipo. Y claro, esto nos trae un poquito ahora, ¿no? Es decir, ¿cómo estáis viendo vosotros? O sea, por un lado, siempre lo más difícil a veces es integrarlo dentro de la organización, ¿no? O sea, a veces no se tiene todos los procesos para poder aglutinar todas estas innovaciones y startups con las que estáis trabajando ahora. ¿Cómo procesáis eso, ¿no? O sea, ¿cómo trabajáis con las startups que se os acercan a vosotros?
Pues mira, para nosotros ha sido, lo comentaba nuestro director general esta mañana, ha sido un proceso largo, un proceso de más de 10 años, cuando empezamos a ver que en el ecosistema había startups, había muchísimo talento que estaban desarrollando soluciones francamente buenas y que nosotros podíamos ayudarles. Y no sabíamos cómo integrarlas dentro de nuestro sistema. Teníamos claro que si integraban dentro de nuestros procesos las matábamos, porque son procesos lentos, complejos, con mucho análisis, con lo cual teníamos que desarrollar algo en el ámbito del emprendimiento. Dejar a las startups que corrieran, que fueran a su ritmo, que se confundieran o que acertaran, pero que fueran a su ritmo, ¿no? Y nosotros lo que hemos hecho ha sido acompañarlas, ¿no? Entonces hemos puesto en marcha, y de la mano de PwC, de Price, en marcha un proyecto de aceleración de startups en las que el proceso o el momento más complejo es el del scouting, ¿no? Encontrar buenos proyectos, ¿no? Encontrar proyectos basados en el impacto social, que quieran resolver problemas reales, pero que puedan ser escalables. Que no sea una mera idea de qué bueno soy, quiero arreglar el mundo, pero bueno, cómo sobrevives, cómo planteas un modelo de negocio realmente sostenible y escalable, y eso no es tan sencillo, ¿no? Pero cada vez estamos viendo compañías, startups con modelos de negocio muy sólidos y que van a llegar a ser unicornios. Tricornios por lo de la Guardia Civil, no lo sé, pero unicornios seguro, ¿eh?
¿Y habéis encontrado alguna vez, sobre todo al principio, ¿no? Siempre pasa fricción, ¿no? Porque me da la impresión de que el equipo de innovación, tú y vuestro equipo, estáis como un poquito aparte, pero ¿habéis encontrado fricción con otras partes de la organización cuando empezáis a engrasar el tema de las startups y por ahí meterlas?
Yo creo que nos han dejado mirar para otro sitio, básicamente, ¿no? Porque la fricción fue al principio, aprobar un proyecto, dotar fondos y encontrar pues la vía de poderlo hacer. El hecho de que una Big Four esté ayudándonos a esto también da tranquilidad a dirección financiera, servicios jurídicos, auditoría, les da más tranquilidad, ¿no? Entonces, bueno, pues hemos podido encontrar ese encaje y nos está saliendo bien.
No les habéis contado, ¿no? Lo de la incertidumbre, las startups y tal, esa parte no se cuenta.
Ya lo sabemos, lo de la incertidumbre lo sabíamos y por eso pusimos en marcha el proyecto, porque no podíamos confundirnos dentro.
Claro. Y esto lo estábamos comentando antes. Bueno, primero, ¿cómo habéis visto la evolución, ¿no? de todo tipo de innovación social y de impacto, ¿no? y de inclusión de hace unos años? Porque como comentabas antes, lleváis años viniendo aquí con nosotros al South Summit. ¿Cómo habéis visto esa evolución? ¿Hay mismos proyectos, más proyectos pero menos calidad, más proyectos pero más calidad? ¿Cómo estáis viendo esa tendencia?
Hay más proyectos de mejor calidad. Lo que te decía, el modelo, base de negocio, ideas, proyectos que realmente van a tener un futuro, es lo que estamos viendo ahora. Antes veíamos mucha idea, mucho espíritu bondadoso, gran corazón, quiero mejorar el mundo, pero no sé muy bien cómo. El modelo de negocio lo basaban algunos en que me lo vaya subvencionando la administración pública o una fundación como la vuestra. Decíamos, mira, me parece que esa no es la vía, esa no es la vía. Estamos hablando de otras cosas, ¿no? Nosotros nos dedicamos a... somos grant makers, nosotros damos subvenciones, pero no es el objetivo. Sacar una startup adelante es otro concepto. Y lo que hemos visto es mucha más madurez en el ecosistema. Y lo que estamos viendo es que también hay otras entidades, lo hemos visto en el panel de impacto social y corporates, cómo se están involucrando en este tema, ¿no? Que también estamos viendo grandes compañías que cada vez están más involucradas.
Yo creo que tocas un tema que para mí siempre ha sido crítico, ¿no? He conocido mucha gente en muchas fundaciones y muchas asociaciones y siempre es la misma historia, ¿no? Esto está muy bien, que la gente quiera ayudar, pero esto tiene que ser sostenible. Nosotros no podemos seguir financiando este tipo de cosas ad infinitum, sino que sean robustos y que crezcan. Y yo creo que en ese sentido, la verdad es que, como dices, sí que ha habido un cambio importante. ¿Cómo ves el futuro? ¿Cómo ves tú esto evolucionando en los próximos 3-4 años?
Yo lo veo creciendo y sobre todo lo que veo es que vamos a seguir y va a haber cada vez más empresas, startups que van a tener esa base de impacto social, pero va a haber otras compañías que no van a tener esa base de impacto social, fintech por ejemplo, que van a querer desarrollar y hacer dinero, pero lo que le planteamos es, ¿esto por qué lo haces? ¿No? ¿Por hacer dinero? ¿Lo haces por poder? ¿Lo haces por prestigio? ¿O lo haces por construir un mundo mejor? ¿Por qué no metes esta cuarta variable en las otras tres y que no tienes por qué renunciar a esta cuarta variable? Lo están entendiendo y cada vez estamos viendo cómo lo están incorporando en su negocio. Estamos viendo desde luego los criterios ESG en las grandes corporaciones, en los fondos de inversión, cada vez están más incorporados y cada vez hay más inversión con criterios ESG. Pero desde luego la S de la parte social, que es lo que realmente nos preocupa a nosotros, sí vemos que se va incorporando de forma transversal. Todavía nos queda, pero el esfuerzo que estamos haciendo todos y el apoyo que estamos teniendo por parte del South Summit, yo creo que lo vamos a conseguir en breve, ¿no?
Joder, me devuelves la fe, ¿eh? Porque yo he de reconocer que lidio con mucho estos temas y a veces me da un poco de esa sensación de ahora porque hay presión social, ¿no? Y entonces nos vamos a meter en los SDGs porque hay presión social y tal. Pero me alegra saber que estáis viendo que realmente hay gente que dice, oye, no es exclusivo, ¿no? O sea, al final lo que es bueno para todos, lo que es bueno para la sociedad, al final revierte en un mejor negocio, una mejor marca, una mejor expansión, ¿no?
Sí, empieza a ser más por ética que por estética y no solo un maquillaje, ¿no? Si no se está haciendo porque lo quieren hacer de verdad.
Te voy a pedir la última pregunta y con esto dejamos que el jurado, bueno, que me pasen quién es el ganador para que podamos darle el precio, pero si tuvieras una varita mágica y pudieras pedir ahora mismo la startup perfecta, ¿qué startup os vendría en Fundación estupenda?
Hemos visto...
Yo sé que me vas a decir muchas, pero
claro,
si tuvieras que elegir una.
Hemos visto ejemplos que, bueno, muchas están en Fundación, otras no, pero hemos visto ejemplos ahora que a ver cuál es la ganadora, ¿no? Estoy impaciente para saber quién es la ganadora, pero hemos visto grandes startups. No me atrevería a decir
no te mojas,
decirte cuál es la...
No tiene por qué existir, ¿eh? No tiene por qué existir. Te la puedes inventar.
Bueno, en la próxima edición la veremos, ¿no? Con lo cual... ¿Te parece?
Yo estoy a ver que me digáis algo que digáis, pues molaría, yo qué sé, una inteligencia artificial que pudiera tratarnos como humanos y que, no sé qué inventen.
A ver, la tecnología vamos a tener todo de base tecnológica, pero vamos a tener cuidado con ella, porque nos vamos a olvidar de las relaciones humanas. Como nos vayamos ahora al metaverso y nos olvidemos de relacionarnos
no abramos
con la gente,
ese melón, no abramos ese melón, por favor.
O bastante complejo, con lo cual lo que sí que me gustaría es que toda la tecnología que se desarrolle tenga en cuenta la diversidad humana, eso es fundamental.
Pues mira, con esa clave que creo que es súper importante, nos quedamos aquí. Por favor, un aplauso para Jesús. Muchísimas gracias. Well, so the winner of this first edition of the Innovation and Social Inclusion Awards for Fundación 11 is Be My Vega. Big applause.
Yeah. Congratulations. Dame un abrazo.
Muchas gracias, Jesús.
Enhorabuena, de verdad.
Bueno, la verdad es que me he quedado sin palabras, ¿no? Pues es
Con gente
una
así,
alegría enorme el haber recibido esto. Llevamos ya bastante tiempo trabajando con vosotros y lo tengo clarísimo, sin vosotros no estaría aquí. Sin vosotros y la ayuda que nos ofrecisteis al principio, pues no estaría aquí, ¿no? Y hacéis una labor extraordinaria. Ya te estoy hablando un poco de mi situación personal y de mi hija, que para mí es lo más grande que hay en el mundo. Esa ayuda y ese trabajo porque cada persona cuente, no sea un eslogan, es fundamental, ¿no? Hay una palabra que para mí es clave, que es la inclusión. Tenemos que aportar valor a todos para que todos se sientan integrados ahí, ¿no? Y desde aquí pues no puedo decir otra cosa que daros las gracias y deciros que esto, pues bueno, pues ya soy bastante cabezón para seguir con la linde, ¿no? Es decir, no dejar esa lucha por integrar a todas las personas en un mismo entorno, pero bueno, pues nos da mucha fuerza, que a veces, bueno, queda menos, ¿no? Porque es verdad que es un trabajo muy duro, ¿no? Quiero agradeceros a vosotros, a Price, ese asesoramiento, esos consejos que justo cuando uno se va a torcer enseguida endereza y te marca el camino, y que todo eso es lo que al final concluye en este trabajo, ¿no? O sea,
bueno.
agradecidísimo y además también muy contento de que en eventos como este de emprendimiento, la parte de impacto social, pues esté ahí, ¿no? Y ocupe esa parte tan importante, porque no solamente es para ayudar a las personas, es para ser mejor como sociedad, ¿no?
Pues
es una
con
parte
eso
que
te
todos
voy a
tenemos que...
parar ahí, porque creo que es perfecto.
Y
Un grandísimo
gracias.
aplauso, por favor.
Bueno, muchas gracias. Muchas gracias.